Hello. Can everyone hear me? So welcome to the eDirectory webinar. We'll be getting going in a minute or two. We're just allowing everybody to log in and get connected. Can you help me unmute that, please? Just right here. Good morning, everybody. We're going to get going. First of all, I just want to check, can everybody see the screen and hear the audio? If you have any issues and we're not able to hear you, please type it into the chat box. Okay, fantastic. So welcome. My name is Rochelle Alley. I am a consultant for the Office of Child Protection and the Center for Strategic Partnerships. And it is with great excitement that we are sharing a new tool that has been developed by the consortium alongside many wonderful partners, which is called eDirectory. And it's intended to help us all connect families to support to keep their families strong, to address any acute dynamics going on in their families, and really help them to succeed. So with that, I want to open up the floor for a couple of our key leaders to introduce themselves as well. Helen and Anna.
Good morning, this is Helen. Can you hear me?
Yes, indeed.
Good morning.
Good morning, everyone. My name is Helen O'Connor. I'm with the LA County Department of Public Health, Division of Maternal, Child, and Adolescent Health, and I am one of the co-leads for the referrals work group.
Good morning. This is Anna Leyva with Maternal and Child Health Access.
Is anyone else doing this?
I am the other co-lead for the referrals work group.
I can't hear because it doesn't have volume.
Fantastic. Thank you, Anna and Helen, for being our fearless leaders. What I'm going to request, we have over 50 people who have RSVP'd to be on the call. So I'm going to just sort of share a little insight into who else may be on the call. It's WIC, prevention aftercare agencies. But instead of having everybody talking, we're going to ask everybody to put themselves on mute. And we may even do it on our end just to help with the sound. And so that way people will be able to hear the webinar information. As we go, if you have questions, we absolutely welcome you to type them into the chat box, and that way we'll have an opportunity to take you off mute later and respond if appropriate, or simply to answer the questions. So thank you all so much for your understanding as we do that. So with that, let's jump in. We're here, as I mentioned, to talk about the eDirectory. It's a really exciting new tool to help it be much easier for us to connect parents to the right resource for them. The first thing we really just want to say is a huge thank you. This has been an undertaking that has brought together and bridged many organizations and resources. And first and foremost, we just want to thank them and lift them up. We had 3 funders who supported the development of this tool: the Partnership for Early Childhood Investment, the Anthony J. Pritzker Foundation, and the RISA Foundation. Without their financial support, this wouldn't have been possible. We also have numerous partners who came together to make this happen. And first and foremost, I want to call out LA Best Babies Network. They actually have been the backbone that set up this webinar technology for us and has been a through line through the work. Many folks there: Steve Nish, Michaela Ferrari, Amber Aviles, Jessica and others, and Jan French have just been at numerous points making sure this work was able to move forward. Center for Strategic Partnerships helped to convene the funders to be able to make sure we had the resources needed. The Consortium Referrals Work Group birthed the idea for this eDirectory and also was a consistent support throughout in testing and guiding the development of the tool. The Department of Public Health has also been a consistent support and also continues to be a support in ensuring that this tool can be integrated into other county systems. And last but not least, MavCode was the developer for the tool. So we're just grateful and want to honor how substantial their contributions were. So some folks on the call may not be as familiar with home visiting. We're just going to briefly touch on what is home visiting. Home visiting is in-home family support that is voluntary. So it's not mandated by the courts because somebody has been in child welfare, but something that is open to families in the community to sign up for, where they can have a trained professional come to their home. And in different models, that professional may have different academic background or training, but they consistently have a strong background so they can bring expertise and support to parents. And what they provide is a mix of parent coaching and linkage to services, so they can support parents with screenings of child development and information about how to best support their child's development, and as they can support with connecting to health resources and ensuring that both mom and baby have the health support they need, as well as other services to address the acute needs that family may be going through, whether it be housing or other types of needs. So why did we make this eDirectory? Why was it needed? It was something that a lot of people called for, and there's really two reasons. The first reason has to do with the value of home visiting, and the second reason has to do with ensuring our system is working efficiently to connect people to the resources that they need. So why home visiting in particular? The reason is because there's a substantial body of research that shows that home visiting works, and it works across multiple outcomes. First of all, it helps improve parenting and family safety. Second of all, it helps improve health outcomes for both mom and baby. As part of that, it has been proven to support the mental health and well-being of family members. And last but certainly not least, research has shown that it consistently helps to improve the social and cognitive development of children so that each child is able to get a strong start in life. So why is the eDirectory needed? The eDirectory is needed for a couple of reasons. First of all, there are, as we know, many moms out there who are facing acute challenges. They may be facing homelessness, mental health crises, medical challenges, or domestic violence. And with the right support, they can thrive and overcome those challenges. And home visiting is a type of support that can help them through those situations. We also know that all new moms need somebody who's knowledgeable in their corner. They could benefit from the empathy and just support of having someone at their side, as well as from information about what child development should they be anticipating at different steps. What does that mean for nutrition? What does that mean for interaction with their child and discipline? So all new moms can benefit from somebody knowledgeable in their corner. Home visiting has different types of models that can serve both of these purposes. However, it's not always that easy for the average person or even the busy professional to know which program is the right program for a particular family. There are tons of great programs, but finding the right one in the right geography that has space can be complicated. So that's why the eDirectory was birthed. So here we are, the eDirectory. This is a snapshot of what it looks like. It's incredibly user-friendly. So what we're going to do is we'll go through what it is with you and a quick tutorial. We're going to then give you a chance to try it out, and then we're going to talk a little bit about how do you sort through, once you know what a family is eligible for and the referral information, how do you sort through coaching and guiding that family on choosing among the programs to support them in connecting to the program that's the right fit for them. One thing that's important to note is the intended audience. It's really intended for professionals who are working with families and pregnant women and trying to connect them to home-based support. It has been developed in a way that hopefully if family members themselves access the resource, it is intended to be a family-friendly language. So it's written so that if somebody finds it, they could fill it out for themselves. Though the true intended audience was for professionals because home visiting is somewhat of a niche resource. The other thing that's really important to note before we go through the quick tutorial is that we really need you. What the system will do for us is it helps identify what programs a family is eligible for in their geography based on their family situation. And it provides the contact and referral information so that any professional or any family themselves can submit the referral information or connect to the right person to get enrolled. However, it doesn't replace the human role. It still requires somebody to sit with a family, with a parent, and gather in a warm manner the information that is required to know which program somebody is likely eligible for and what program might be the best fit. That still requires that human conversation to gather just that basic information to connect to the right resource. And perhaps more importantly, or most importantly, it still requires your partnership to provide that warm handoff that people talk about, to help the family decide which program they want to reach out to sit with them and make the call together to check whether or not there's availability, and then if not, to help reach out to the next best program or help the family fill out paperwork. You know, as a parent myself, I've had that situation where sometimes somebody gives me a resource and there's a little bit of paralysis as a parent before you actually follow through, where, you know, you've got a lot of concerns and you've got a lot of worries. You're not sure if it's the right resource. You're really busy because you're juggling work and other things. And we want to make sure that people don't just get, you know, a name and a number, but that we're really supporting them and connecting efficiently to that resource. And that really requires that human touch beyond what any technology can do, and that's where we really need you. So the eDirectory is really user-friendly. As you can see with the arrow on the screen, you start with a really simple breakdown of, are you pregnant? Are you parenting a child 0 to 5? Are you pregnant and parenting? And the reason it starts with that is that question actually really determines the set of programs that are going to be the right fit that a family would be eligible for. The system is only going to ask questions that are needed to identify and clarify the programs that are available to a specific family. So it's eligibility-driven questions. It's not a full assessment by any stretch of the imagination. It's not meant to be a strengths-based assessment. It's really meant to be an eligibility and connection resource. We have been assuming, based on conversations with all sorts of people in the field, that those deeper assessments are already done, and redoing it would be more duplicative than helpful. So it's only going to ask the questions that are really needed to connect the family to the programs they are eligible for, and to clarify the referral mechanisms for those programs. Once you click that initial questions, there's going to be a series of about 4 or 5 screens that ask some simple additional questions to determine which programs a family would qualify for. So the first one asked about whether or not the person has confirmed their pregnancy, their gestation if they're pregnant, and all of these questions I'm going through right now are the ones that would show up if somebody says they are pregnant or pregnant and parenting. It's going to ask about geography, Medi-Cal eligibility, and whether or not it's this is their first child, that they're their first pregnancy, or that they're expecting their first child. And again, all of these questions have been chosen because they would make someone eligible or ineligible for various programs. The next thing it will ask is about intention for birthing hospitals, again, to help determine which program somebody is eligible for. And then it asks about a set of criteria, all of which are eligibility determinants for various programs out there. And we bucket this as certain programs specialize in helping families with specific circumstances. If you look at the details here, one of the questions that we get sometimes is, are these all risk criteria? How did you determine these? There are some things on this list that people would call risk criteria frequently, but some of them are really more about just being part of a particular community or part of a particular population. For example, teens are on the list because there is a nurse-family partnership program that specifically focuses on students in LAUSD. So you see those listed, as well as teens are a eligibility population for other programs. You'll see that American Indian is listed as one of the check boxes because Partnerships for Families has a program specifically for members of the American Indian community, and so that's something where not everybody would be eligible for it, but those families who are eligible might be interested in that program in particular. So this helps us to ensure that the referral information that comes up is specifically for those programs that an individual is eligible for, as well as they are things that might be attractive to a particular family, really seeking, either who's seeking help for a specific issue or who feels like they want to be part of a program that's more oriented toward their community. This then follows up with income information because income is a consistent criteria for screening for some of the programs. And last but not least, the result is that the system will then provide a list of the programs that family likely qualifies for, with the contact and referral information for the local provider for those programs. And as you'll see, it provides on the left the names of the programs, and if you click on that, you can get more detailed information on each one, contact information, phone information, website and referral forms, etc. The other thing you'll see on every page is a link to a full listing of all the home visiting programs with descriptions. This is a great resource for professionals who will be referring families over, as well as something that you can hand out to families and sort of check off the things that they are eligible for so that they can take it with them and think more. That same list is also available in Spanish, and the list of referral information that comes up is also available in Spanish so that it can be printed and handed out to families so they have their list of the programs they're eligible in either English or Spanish. And this is important. At the bottom of the results page, there is a feedback option. It's incredibly important that if you notice anything has become outdated on the website or anything doesn't work, please use this email to let us know. The tool will only be effective if we can keep it up to date. It's very easy on our end. The LEBBN team has the capability to update it very quickly on their end to make sure that the information is fresh and current and correct. However, it's very easy for, it's very easy for the for something to slip through the cracks. So if you notice anything needs adjusting, please just email us, and that way we can keep it up to date. Somebody has just mentioned something about the screen. We're going to try to fix it, but I'm going to, just out of respect for your time, I'm going to continue with the presentation while somebody from LEBBN is going to see if we can adjust it. Somebody wrote in that you're seeing the next slide and the current slide, that it's not projecting through in presentation mode. So we'll try to work on that, but I'm also going to continue so that we respect your time. Okay, so we're gonna give you all a little time to try it. It's, as you can see, pretty quick, so we'll give you about 5 minutes to try it out. After that, we are going to talk a little about, with this list, how do you think about guiding families and coaching families about which program might be the best for them. So we will regroup. It's 10:21 now. We'll regroup at 10:25. What I'd love for you to do is go to eDirectory.homevisitingla.org and just click through it once and try it out, and then come back to the webinar. Is it working? Mm-hmm. Okay. Okay, everyone, welcome back. Hopefully you found that super user-friendly. That's the way it's intended to be. So the next thing that we want to talk about is we frequently are asked the question of, okay, so now we've got this list. How do I help coach a family about which of these programs might be the right one for them? And this is a very unofficial cheat sheet. There may be people out there who don't necessarily agree with the way I'm going to communicate it, but this is the way that I would recommend you sort of initially approach becoming more familiar with these programs, or explaining some of the thinking through some of the differences between these programs when you're working with families. You can start out by breaking them into 3 buckets. The first bucket is Welcome Baby. The second are programs that were developed and intended to support families with acute challenges. And the third is for remote programming. So there is essentially one program in the first and the third category, and there's many programs in that bucket of programs for acute, that were intended for families with acute challenges. So Welcome Baby is a program that's available for families delivering at the 14 participating hospitals, and it's open to those families delivering at those hospitals regardless of risk factors or socioeconomic status. People are welcome to participate if they are facing acute challenges. It's not that those families are excluded, but rather that they, it's not a requirement. It is delivered by trained professionals who provide support and education during pregnancy and through the child's first 9 months of age. So that's one of the distinguishing things about Welcome Baby is it's considered a lighter touch program. So they aren't necessarily going to have as many touch points or visits as some of the other programs, but they are still, at the same time, they're still providing that trained personalized support to connect to resources and ensure that families have a healthy pregnancy and a strong start to life. So that's the first category. I'll do the third category and then I'll launch into the second one. The third category is USC Parents as Teachers Telehealth. That's the only program in LA right now that is a remote program. They use iPads and online meetings with parent educators. And so if a family really is feeling like they aren't yet comfortable with somebody coming to their home, they'd rather do something remotely, or if they live in a more rural area and they just prefer the format of an online session, that program is the one in LA that is going to offer that remote format. And then there's a whole set of programs that all were developed to support families experiencing more acute challenges. So, so within that bucket, I would say a couple things. One is we're going to walk through and talk through what those differences are. But that said, I also just want to start by lifting up that many of these programs could be a fit for any given individual family. They could all, there's multiples that sometimes could be a great fit and provide wonderful support for a given family. And in some cases, the determining characteristic is really, do they have availability now, or do they have a wait list? Are they able to offer the program in that family's language of choice at that time, just based on the staffing who's available? So part of finding the right fit is about being knowledgeable about what these programs offer their intended participant community. But a large part of it is what we referenced earlier about the technology can't replace the human touch of just being at a family's side, making those calls to find out what availability they have at that time, when would the family be able to be enrolled, and just confirming things like language access, etc. because availability really may be a key contributor to whether or not it's the right fit for the family, as much as the curriculum, etc. That said, some of the differences are nurse family partnership. There's two things that I would highlight. One is that it's provided by a nurse. So families who are really interested in having somebody who has that medical background and training and feel more comfortable with the idea of a nurse, that can be an attractive part of their program. They also have a specialty for LAUSD teens. So if the individual coming to you for guidance is an LAUSD teen, that program might be a strong fit. Mama's Neighborhood is particularly strong in supporting families with medical challenges or very high-risk situations, such as if they are homeless, etc. It's a program that's integrated with Department of Health Services medical services. So they are able to really wrap around families with support both on the medical and the resource side. So that's something that is sort of a characteristic that sets Mama's Neighborhood apart. Early Head Start, it's a program intended to support families comprehensively. They have a particular eye toward ensuring support for low-income families and for children with disabilities. So if a family has been struggling with accessing the right types of support for their child who has a developmental delay, or they're not sure if the child has developmental delay, Early Head Start is a program that might be a good fit. Again, there's a lot of commonality among these programs, so other programs can also provide that type of support, but it's a program that in particular looks to serve low-income families and families with children with disabilities. And also just looks to really provide comprehensive support for the family's goals. So not only the child's development, but the family's financial well-being and broader family goals. Parents as teachers, one of the determining characteristics is it's provided by a parent educator. Similar to Early Head Start and some of the others, it offers visits twice a month, as well as group meetings, so that there's a chance for parents to connect with other parents, as well as have individualized support. It's also a characteristic of Early Head Start. It serves families through the preschool age, and it has a little bit more of a child development flavor and more education, preparation, support focus. That's sort of the lens. So if a family is really motivated and interested in the driver for that family is supporting the child's development, Parents as Teachers might be a really good fit for that family. Healthy Families America is also an evidence-based program. It's intended to support families who have experienced trauma or going through mental health or substance abuse issues. It's available all the way through a child's 5th birthday. So if a family is really interested in long-term support, that is one characteristic that sets Healthy Families apart. And again, it's similar to the others, supports child development, school readiness, and health. Partnerships for families. One of the distinguishing characteristics here is it's developed by master's level professionals. So if somebody is really interested in that type of professional providing support, that is a characteristic of the program. It's specifically intended to support families with substance abuse, domestic violence, or mental health challenges. So not only will it only show up as an option if you indicate when you're going through the program that those are present in the family's life, but it's also something you can think of as what might determine partnerships for families being a good fit for the family. The other thing I will lift up is Partnerships for Families does also offer a version of the program for specifically for Asian American families, as well as Native American families. And so that's something where that's available through partnerships for families specifically. And last but not least, Healthy Start, their lens is really focusing on improving health, healthy birth, and strengthening family resilience. So that's the lens for Healthy Start. So each program has slightly different characteristics, slightly different flavor or details, and in many cases, different staffing in terms of who they hire to come alongside families. Again, I would just emphasize that you can use this as a guide to connect families to the program that might feel like the right fit. And also, it's important to help families make that call to just double check whether there's availability, because in many cases, any number of these programs could provide wonderful support to a family, and we want to make sure that families are able to connect to the program that has availability at that time and the language and other dynamics that they need. The system will connect you to the right referral information and paperwork. However, it's not necessarily real time enough that we know all the details in the same way that calling and speaking to the program directly will achieve. In the program earlier, you saw that we went through the pregnancy options or the pregnancy screening questions. The parenting, a child 0 to 5 and pregnant and parenting work the same, so there's nothing especially new there. I'll just click through. As you can see, the only difference is that if somebody is parenting and not pregnant, it will not ask them any of the questions that relate to pregnancy or that apply only to programs that will only work with pregnant moms. So quick quiz. What should you do if you notice that there's outdated info? As we mentioned earlier, we really appreciate if something becomes outdated, just send us an email so we can correct it right away. In a minute, I'm going to turn it over to you and you can try out the other parts of the website. But the last two things we want to say before we do that are just to make sure to, whatever your system is, if you have a binder, if you like to print things, if you use bookmarks, to make sure to note the eDirectory in your workspace so that you can access it really easily and help families. Thank you so much. I am going to try to take you all off mute for a moment and look through the chat questions to see. Yes, you can receive an emailed copy of this presentation. We will post it on the consortium website as well. We are recording it, and so we can send that out. I'm just scanning through the questions. Email, yes. Somebody was mentioning for NFP, it goes up to age 2. That's correct. We can add that. And yes, NFP is also evidence-based. See other questions. Okay, so those are the questions that have come in so far. I'm going to step to the side and Jessica's going to help us take people off mute in case anybody wants to share something else. Okay, you guys are off mute. Did anybody else want to jump in with any questions?
Wow. But she'll be at her home.
Okay.
Don't call her.
Okay. Well, it seems like we don't have any other questions. If you feel free to email that same email, the coordinator email, and we can get back to you and email it out. We really appreciate all of your time today, and we will send out links and post this recording so that you can share it with your peers. Thank you very much.